we see in the urgent care setting. And most of the time, patients who present with headache have one of the first two on this differential diagnosis list. They have a migraine headache or a cluster headache. But if you look at the list further on down, you can see that there are some pretty serious things on that list that we need to make sure a patient doesn't have. Things like subarachnoid hemorrhage, acute glaucoma, temporal arteritis, and CNS vasculitis. So problems that we really need to manage directly and early on in order to avoid sequelae. Like everything else, again, we'll do a careful history and physical exam, and then we will govern our further treatment and our further workup based on that history and physical. Now, there's some pearls that you want to think about when you're managing a patient who presents with the acute onset of headache. The first one is that if you suspect bacterial meningitis in the patient, then you want to give the patient antibiotics first thing. You don't want to wait for their spinal tap results to come back. So give them their first dose of antibiotics before you get your laboratory test back. The second one is that a patient who has a chronic migraine headache who presents to your office or to the emergency department with symptoms that are different than their typical migraine may have something else going on. So don't just chalk it up to a migraine headache just because they have a history. The next couple pearls have to do with diagnosis and management of acute bleeds that are associated with headache. A CT scan can be used to rule out a bleed that's greater than 1 centimeter. So that's a fairly large bleed, and if you have a suspicion, then you want to consider doing a lumbar puncture to rule out a smaller bleed. Ischemic CNS events that are 6 to 12 hours old can be diagnosed using an MRI, and that will tell you some early ischemic changes. If you have a suspicion that something's going on or you have some uncertainty with a patient who has a headache, then the best thing to do is to hospitalize that patient and then